Welcome back to Great Day. Here are some shocking numbers for you. Millions of Americans have obstructive sleep apnea. Here's the one that gets me, though. About 90% of those millions don't even know it. Lifestyle changes, mouthpieces, breathing devices, and surgery can help, though. Dr. Anna Smith from Dentistry with TLC in Godfrey, Illinois is here to show us how oral appliance therapy can bring you some relief. Her husband, Travis Smith, has found success with one particular treatment we're going to talk about this morning, too. So we say welcome back to both of you to Great Day St. Louis. Nice of you guys to be here. So let's sort of lay the foundation here and talk about sleep apnea. For folks watching that aren't familiar, what is that exactly?
Sleep apnea is when you stop breathing whenever you're asleep. And the problem is you're asleep. You don't know you're doing it. And I kind of compare it to how many times has someone maybe told you that you snore when you're asleep and you say, no, I don't. I never hear myself. Well, this is deadly. You may be doing this and you don't even know.
So I've heard a lot about this. I work with some folks here that have dealt with this. I don't think about a dentist as the first place that I would go. Should I, though?
Most people don't think about their dentist, and that's really because most dentists aren't trained to do this. The only reason I became trained to treat sleep apnea was because my husband, Travis, had sleep apnea, and the only option he was given to treat it was this huge mask on his face to try to sleep with whenever, or try to breathe with when he would sleep, or to have surgery. And we didn't like either of those options.
Right.
So I started talking to other dentists, going to seminars, really researching what can I do to help. And turns out there is an amazing alternative that you can get rid of your CPAP machine, you can feel better during the day, not be as tired and sleepy, and be a whole lot healthier.
You mentioned the CPAP machine. Travis, this bad boy right here is yours, and you are wearing this thing at night, every night, right?
It's a torture machine.
Well, it looks like a monstrosity.
Yeah, I couldn't do it. It made me claustrophobic. It was just bad. Couldn't turn over. It was just didn't work for me.
And you were actually part of a sleep study, and you told me that you would go without breathing for how long sometimes?
I had one episode over 100 seconds.
That's unbelievable.
Which I cannot hold my breath that long, but during the night, I was practically dying in my sleep. My body was trying to keep me alive, and people do die from this. So, you know, it's serious. More than just sleeping well, it's life-changing.
Sure. So clearly there's a health issue here. This is not just some aesthetic or acoustic thing for your spouse at night. This can really be a serious issue for you. So we go from this to something that's just a little bit smaller, shall we say. This is something you might find at Dr. Smith's office. What is that?
This is an oral appliance. In our office we call it an OAT, O-A-T, for oral appliance therapy. It's like a retainer. Everybody can get used to this. Nobody has issues getting used to a retainer. It's two pieces. One goes over your top teeth, one goes over your bottom teeth. You wear it while you sleep. There are no hoses. There's no air being forced down you. There's nothing restraining you or getting messed up in your bed. It's completely comfortable and easy to get used to.
And Travis, you've used this, maybe are using it now.
Yes.
What do you think of this?
It's my most prized possession.
Is it really?
I don't have to worry about electrical outlets. I can travel with it. It just, you know, small, obviously, and it's been life-changing. It's just the best thing I've got at my possession.
That's pretty cool. Obviously, it's got to be sort of tailor-fit to the individual, but you said for folks that mention this show, you might cut them a little deal?
Yes, we do. We have a special promotion. If you if you call our office in the month of January, we will make you a consultation appointment for only $49. If you decide to go ahead and get an OAT in the month of January, we will give you $1,500 off.
Whoa!
Huge.
Holy cow. Last time you were here, by the way, I heard you got great response. You were here talking about fast braces.
Yes.
Fill us in one more time real quick on those, because you're still into that, too.
Absolutely. We do everything in our office, so if there's anything you need, we do it. But fast braces are amazing. They straighten your teeth in about 3 months to a year. They cost less. They are no more sensitive than original braces, and the people we have them absolutely love them.
That's why they got so much response. It's because they're so much faster and they're even more comfortable.
Yes.
And you got to check this out, too. If you know somebody that's dealing with sleep apnea, or you are dealing with sleep apnea, Dentistry with TLC has a great website, too. You can check out the full interview that we did some time back about fast braces and learn more about Dr. Smith's full range of services. Her office is located just 30 minutes from downtown St. Louis, up there in beautiful Godfrey, Illinois. Give them a call, 618-466-0733 for an appointment, or visit them online at dentistrywithtlc.com. Thank you both so much for being here.
Thank you, Matt.
We appreciate it. You bet. Ken?